Any questions out in the audience? Al, go ahead.
Here we go. This has been a great day, but the real cost of health, which you guys know better than I do, is elder care, which I've testified to the state senate on, can, with the growth of number of elders, be $1 million, not a $500,000 for 1/3 of people maybe. And Medicaid, I don't know how much of the budget is for, shall we say, long-term care, and they're all in jeopardy, and they are not adequately integrated or brought together in this health care debate. Because some of what I hear, and I don't follow it as close as you do, is elder care, elder health or long-term care are being de-emphasized by all people because it's too damn expensive. And I don't know how you link the workforce and, shall we say, the retirement, early or not, into this cost picture. Now, I don't know how you do it, Lou. I'm not against all we're saying here, but how do we get people prepared for $500,000 to $1 million for 1/3 of our population?
Well, I think the first thing you do is you don't have the death panels. And the second thing you do is you try to figure out what is proper coverage and what is proper treatment for people as they get older. Who wants to try to touch that? Peter?
I'll talk a little bit about it. I mean, obviously, some of the wellness activities and programs that we're promoting, as many others are, will help with that by keeping people healthier, more ambulatory, less in need of longer-term care and ambulatory support and so on. So that's a wise investment in the long-term post-working life as well. There's no question that reducing smoking rates, for instance, is a vast cost reducer for Medicare, Medicaid in the future. There's no question that the current healthcare debate essentially avoids that long-term care discussion. New York, which has a reputation, among other things, as the highest Medicaid spending state in the country, that's largely because of the money we spend on long-term care and people over 65. It's not about kids and working-age adults. It's about older people, and so it's a huge problem for the taxpayers of New York and for many other states. We're much more generous than other states in terms of our long-term care and other benefits under Medicaid, which is why we have such a high cost. I mean, California sort of sections that off from Medicaid, so it doesn't show up in their Medicaid program, but other states, which, you know, we've continued as a society, we've just avoided that discussion.
Christine had a nice way to close up the panel on business development. So let's start with Ernie and work our way over to Troy. What is the one message you want to give our audience?
Well, with Atlantis Health Plan, they are, I say, the one company. That's why I came to this company, because of what they're trying to do for the small business owners. I've been in the health insurance business for a little over 20 years, and I've seen what they're trying to do and trying to help the small business owner out. So I would say if you're looking for any type of plans and any type of direction, just look us up on our website and we can sit down with anybody and help them with their health insurance problems.
There's an awful lot of, despite all the pressing news about money and bureaucratic problems, there's an awful lot of opportunity to have enormous successes in the healthcare arena, in the prevention arena, that the investments do pay off.
I'd probably just say that, you know, as we wait for federal health reform, don't sit on your hands. There are options out there right now that you can look at for your small business that will help you reduce costs. I don't think any of them are perfect. I think we've been looking for a silver bullet for a long time. I don't think federal health reform will be perfect either. But I think, you know, with the tireless effort of a lot of these organizations, you will see some changes coming, which will be for the better. In the meantime, though, do your homework. Make sure you know what you're getting, and look at the options that are out there that can help you until the time comes where there's a little bit more sweeping legislation.
As I say, there's a lot of fear among small businesses about the healthcare reform that we see coming from the federal government, and I would say don't have so much fear, in large part because the system is so bad right now that almost any reform will be better, and the numbers and the evidence bear that out. It is important what the details look like, but generally speaking, reform is going to be good for small business.
I would say the exact same thing. I mean, Ben took what I was going to say, which is I think reform, while there's a lot of issues around the edges that we'd really want to improve on the whole, it's going to be better for everybody. And one last thought, which is you get the system you pay for. And so really looking at how we pay for care and how that influences choices among providers and consumers is huge. And so I'm really optimistic about a lot of the ideas, from medical homes to medical guidelines, that can help change things on the ground.
And my final message is thank you all for sitting through a very informative session. I want to thank our sponsors, American Cancer Society, Verizon, our partner, Greater New York Chamber of Commerce, CBS News Radio 88, they are News Radio, H&R Block, and NYSET for helping us with today's event. I also want to thank Allison Hirsch, who worked tirelessly on the activities here today, Christine Serrano-Glasner, who is our conference coordinator, Oshri Ben David from Eretz Yisrael, and everyone else who helped out today, Diane Masters, etc. So thank you, everybody, and have a good day and a good weekend.